That is one good-looking girl right there. My name's Whitney Snow. I work with Dr. Frazier at Flying Horse Medical Center. I'm a PA, and what I'm going to be talking about is facial aging, skin aging, and some hormone stuff. So I don't have as many slides as them. Mine will be a little bit more brief, but please feel free to ask questions and let me know if you think of anything along the way. So all of us are aging. I love this app. This was one of my kids and I's favorite app, is the facial aging app, and it gives you a little bit of heart flutter when you see it, because we're all doing this. We're all aging. Our skin is changing. We live in a super dry environment, so this happens. We get dull, flaky, flat skin. We get deep lines, here in the middle of our eyes where we're glaring at the sun all day. We get volume loss in the cheeks, through the lips. We get sagging skin in our lovely jowls down here, which this picture really does. And it makes it hard to embrace our reflection, to look in the mirror every day and be like, I'm really happy with what I'm seeing. And the goal is to age gracefully, and that's a very common thing that we talk about, is just aging gracefully. But what does that mean? How do we get there? What does that look like? And I do want to say that I would like to age great and then die quick. That sounds very nice. I like it. I'm going to use that myself. But yes. So how did we get here? This is a great picture that's, I believe, from Allergan, which is an aesthetic company. But I love this picture. This is genetically the same, as good as you get genetically, from a daughter at age 26 to her mother at age 64. 40-something years difference. But this is what you get, is what are we doing on the outside, what's going on the inside. So genetically, these ladies are pretty similar. Their face structure is the same. They have high cheekbone structure. But then as we age, obviously there's certain things that go on in our body, and we'll talk a little bit more about the hormones and stuff like that. But what do we do extrinsically, or what are our habits? What are we doing? There's a lot of fun things. Exercise is a huge one on here. I'm an 80-20 kind of person, because I think people who try to do 100% of something is crazy. Doc's 100% kind of person. He's all or nothing. And I'm kind of sitting right there in the middle. So 80-20, what can we do to help us age gracefully from a skin standpoint? So avoid sun, wearing sunscreen, all the things that we know about that. Staying hydrated. When you are doing Orange Theory 3 or 4 times a week, you're not hydrated. I can almost guarantee it. So more and more and more. And that's not just water. That's vitamins. That's nutrients that you're losing through your urine and sweat. So replacing those. Stop smoking. Stop vaping. Stop whatever you're doing with this. Repetitive motions. Straw drinkers, smokers. They do these little repetitive motions with their lips. The people who are, making the furrow, and I can't do it because I have Botox, and we'll talk about that too. But it's this motion where you're like totally frowning at people. You get this line, right? So repetitive motions, we want to stop doing those. Regular exercise, and of course a healthy diet. And like Doc said, healthy diet is different for every person. He was talking about the keto diet. If I did the keto diet based on my genetics, I'd probably have a heart attack tomorrow. So not ideal for everybody, but a healthy diet for you specifically. And then, of course, the regular aging process. So here's some facial aging. Another great picture that I didn't put together. I think this might have been Allergan as well. But I really like this. And what this basically looks like is the fat layer, or the bone layer, the muscle layer, the fat layer of the skin. So when you're 35, I like to think of this little triangle of beauty. Everything's nice and high, and through the cheeks you have a little pointy chin, your jawline's nice and straight. And then as we age, and I'm going to say that every one of us is aging better than this, because 55, she looks frumpy. But this is what this looks like. And every 10 years, every 3 years, everything kind of starts to slide down. So the bone structure is not as strong as we lose some of that bone health. The muscles, the fat, everything starts to slide down. We lose the beauty, the triangle up here through our cheeks, and it starts to come down to our jawline where you get the jowls. You get decreased in your skin elasticity, you get decrease in your collagen and collagen production, all of that being normal stuff, but how do we make it better? When we talk about embracing our reflection, and that's just what we say at Flying Horse Medical Center, it really just means being able to look in the mirror and be happy with what you see. It's not perfection. None of us are perfect. We're not all symmetrical. These are drawings, not real people. But we want to look in the mirror and be happy with what we have. So our goal at Flying Horse, and hopefully your goal too, is just to age naturally, and to remember that skincare is, and aging too, is not a sprint. These are marathons. People can spend thousands of dollars and go to a plastic surgeon and look 30 years younger. That's not really our goal. Our goal is just what can we do every day to make it better. Having realistic expectations when you talk about your skin. The same as when you're talking about exercise. It's hard to go from the couch to running your marathon. There's little bits in between there that you want to achieve. Education for us at Flying Horse, just like Doc, fantastic educator on this stuff. Education is key. And when you're educated, you feel confident with it. And that doesn't mean that you know everything about it. We don't know everything about our fields. But when you're educated, you become more confident in those small steps. So education in the beauty department and aging is very important. And then, of course, just building relationships with your providers, trust and understanding. So let's go to our hormones. I also kept this one short. It could be a lecture on its own, and we do some of these lectures. But hormones, just like cardiovascular health is very individualized. You could take myself, I could get blood drawn at a certain day of the month, and it would look very different on a different day of the month. It would look different from my morning draw to the afternoon draw. So when you're talking hormones, male or female, it's really important to understand where that person's at in a stage of life, as well as what time of day it is. I mean, that's a big deal. So we'll go through these just as what your parents never knew about aging. Again, every person, they are unique. Every one of us is going to age from a hormone standpoint, and it's going to be at different rates. It's going to be different levels. Some of us are going to like that aging process. Others of us are going to hate it. So everybody is unique. They're constantly changing for the good and the bad. Just like somebody had mentioned about the estrogen. Estrogen's fantastic most of the time, and then it's not, and then we don't have it, and now we look like men from a hormonal standpoint. So that's not all bad. Estrogen can be replaced, but it has to be done correctly. It has to be done under a watchful eye, and there are really great benefits of that. But not every person should do that. If I had breast cancer, or I was somebody who formed blood clots, I would probably not do well with an estrogen replacement. Doesn't mean you can't do it. It'd have to be very watchful, but it's not something that we would want to not know about, or we could just throw it to anybody going through menopause. You don't have to age alone. I think, and Doc and I have experienced this in our practice a lot. Docs on the outside are fearful of hormones. They're scared to give a male testosterone. Well, what if they had, prostate cancer? Well, we watch that. That's okay. They're just afraid to do it, and some of it is just in our practice. We're able to watch closely, to follow up closely. I don't mind testing blood more often to know where we're at, but you don't have to do this on your own. Some people, again, they'll go through the aging process of hormones, no problem. Just like any of us in here as young women who went through puberty, and you think, well, gosh, my sister did that great, but I was a hot mess. Two different things, and you're going to have friends who have no problem and others that struggle. And there are obviously options to help us age gracefully. And I really like the warning, because I think that it says, due to the influence of hormones, I could burst into tears or kill you in the next 5 minutes. And Doc works with a bunch of women in our office, so I think, sorry about that. All right, menopause. So menopause is normal. It's what we do. It's a good stage of life, same as puberty. It's not always fun, but you get through it, and there's good things from it. But it happens to all women, and symptoms can be irritating and dangerous if not watched. Hot flashes, vaginal dryness, decrease in sex drive, inability to sleep, mood changes, depression, and osteoporosis or loss of bone. So that's where our cardiovascular risk increases as well. As our estrogen decreases, we get this flip, and now we're at higher risk for cardiovascular disease. We were pretty good for a while. We were pretty in the safe zone, and then, again, we turned to men. With osteoporosis, it's a big deal. So it's something, we do DEXA scans to look at that, so it just takes an overall look at your bone density. I don't think that starts till age 60, right? So, even for somebody like myself, that's one of those things that you think you're kind of perimenopausal or getting into that stage. It's something to keep an eye on and recognize that this is a risk as we get older. For men, it's not really a male menopause or andropause, whatever you want to call it. And I thought this was interesting, huh? Menopause. I didn't know this. I came across this, and it says for menopause, doesn't happen to all men, but it says 20% of men over age of 60 and approximately 40% of men over age of 80. And I think that's kind of funny because over 80, your testosterone's kind of in the toilet anyways. But so I don't know how they came up with that number, but. Testosterone, it's, again, very individualized. When I check hormones on patients, male or female, I think it's real important to let them know that I don't know what your perfect numbers are. So when we check testosterone levels in men, it can be normal range from 250 to 1,100. That's a big range of testosterone levels. For women, when you check, let's say, estradiol or your estrogen level, depending on which stage of either your menstrual cycle or menopause, it can go from 0, no, really not 0, but let's say 10 up to 200, and that's for varying phases. So they're very specific. And when did you feel the best? When did you feel the best? And that's what you kind of have to remember, that not everybody is going to feel the best at the same numbers. But back to our menopause. Decrease in muscle mass and overall strength, decrease in the bone mineral loss. Again, the testosterone piece of that helps. Low libido, erectile dysfunction, energy, depression, cognitive impairment, or just, that forgetfulness. When we move through our stages of life and the levels fluctuate, I really like this our 7 dwarves, that's funny. So there's tons to know, and everybody's well educated, so you kind of recognize some of those symptoms on your own. But I think it's important to understand your symptoms. Women are great chatters, so we'll sit at a table or go for a run or sit at coffee, and everybody has their own little things. Some people suffer from I can't sleep at all, and another person's sex drive is in the toilet, another person can't lose weight. And you talk, but what is it specific for you? Because the hormones that we potentially could replace may vary. And getting tested, I think that is so important, so important. We've had people sit in our office and say, well, I'm pretty sure I need this. And you test them and you're like, well, that's really not what you need. It might be a thyroid issue, it might be an iron issue, it might be the B12 and folate issue. So getting tested is so important, and that's what insurance is for, right? They cover nothing, but they will cover some of that. Understanding your options for treatments, which we'll go over, and discussing with your healthcare provider. Again, not every healthcare provider is going to be open to that discussion, but finding one that will, and that they'll listen to what your concerns are. Treatment options. I can't read that too well, but in our practice, we like to use bioidentical hormones when we replace hormones. That is, they are built exactly from a molecular standpoint, just like your own hormones. So your body accepts those well. It has less side effects to it. When we talk about treatment options, females you can put stuff on the skin. You've seen patches. You can do vaginal replacements, orals, and then pellets. Pellets are what we typically use in our office. And then from a male standpoint, again, you can do some skin, transdermal, probably my least favorite of all for them. We can do testosterone injections and pellet injections. For women, we can replace estrogen, testosterone, progesterone, all of that through any of those forms. And then males, normally it's just testosterone that's replaced. It's hard to speak on the broad, again, just like Doc and Annie are both saying, everybody is so individualized. And that's what I love about our practice, is being able to specifically look at you specifically. Because your neighbor is not your girlfriend, your husband down, everybody's different and their needs are different based on their labs.